Hey guys, I don't even know where to look because of how the camera is set up, but I had to do it that way because this is Jessica's mom's story and I wanted to do it justice, and I can't hold the iPad and film very well at the same time. So I've tried to do this at least 50 times and failed. I'm hoping today that I am articulate and I can get through it. So here we go. ALS is Lyme. Education is key. My name is Jessica H. I am a 2002 graduate of Cumberland High School, and I am employed at the post office in Greenup. My mother, Tonya N. from Casey, Illinois, was diagnosed with ALS by a neurologist and ALS specialist in Illinois in May of 2020. In the summer of 2020, she also went to the Mayo Clinic, where they also diagnosed her with ALS. They told us it was impossible for her to beat this diagnosis. ALS is a terminal disease with no known cure or cause. There is not much treatment for ALS. The medication offered at best would only add 3 months onto life, but came along with horrible side effects. I really never knew what ALS was until my mom was diagnosed with it. However, without going into great detail, when someone has ALS, it affects both upper and lower neurons. As the disease progresses, abilities are lost. Eventually, at the end stages, you are paralyzed from the top of your head to the tip of your toes. You will require assistance to breathe and eat. The typical lifespan of an ALS patient is 3 to 5 years. However, you progressively lose function throughout this time. It is impossible to beat ALS. You are only progressively worsened. It is what nightmares are made of. In February 2021, my mom went back to the neurologist and she said she was slowly progressing. I became desperate and cried out to God, begging him to heal my mom, and I would scream his name from the rooftops. The same day, I had a thought to add myself to an ALS support group. I chose the very first group I saw, and the very first post in the group in all capitals letters written by Alex T said, "You don't have to die. Google Lyme disease test accuracy and thank me later." I did, and less than a week later, she had an appointment with a Lyme literate medical doctor. Special thanks to Nicole H, not only for the recommendation, but also the Lyme education. This Lyme specialist gave my mom a Lyme test that includes bands that the Western blot excludes. My mom was tested for Lyme at Mayo Clinic and it was negative. In April 2021, my mom got her IGeneX lab results back and she was indeed positive for many tick-borne infections. Some doctors tried to tell us these infections were rare. Some doctors say these infections are not in Illinois. Other doctors even say these tests are fake and chronic Lyme does not exist. They told us it was impossible for her to heal, that it was impossible for the infections to cause her symptoms. In April 2021, my mom started treatment targeting the specific infections that IGeneX test pinpointed, and all progression stopped. Not only has my mom's ALS stopped getting worse, her ALS is reversing with Lyme treatment. Lung function improvement, more energy, decreased cramping and tremors, regaining strength where muscles had disappeared. My mom was given an expiration date of 3 to 5 years. Here she is 3 years into her ALS diagnosis, and she is in better health than when she was diagnosed. Mom doesn't require any type of assistance. She is able to work 40 hours a week and live a normal life. My mom's in better health now than when she was diagnosed with ALS. We all know with God, all things are possible. My mom was given a 0% chance of beating ALS, no hope, no cure, no treatment to speak of. My mom would be the first person to beat ALS. Not only has he saved my mom from a terminal illness, he is healing her from a disease the CDC says doesn't exist. I could never be more grateful. Thank you, Jesus. Since finding my mom had Lyme, I met others like my mom who were diagnosed with ALS and found out to be chronic Lyme. My friend Michelle S. came up with the idea of starting a Facebook group called When ALS, MS, TMS is Lyme. In 2 years, this group has grown to almost 2,000 people. People from all over the world diagnosed with these horrible diseases. With proper, accurate testing, finding out that chronic Lyme disease and co-infections can cause these symptoms. People from all over the world are getting better with proper treatment, and many are healing. He made it possible. Lyme disease is the great impersonator and can mimic many diseases, not just ALS. According to Dr. Alfred Miller, a retired Mayo Clinic physician, he practiced private practice internal medicine rheumatology for 40 years. Dr. Miller, retired full medical professor, Department of Medicine, Clinical Faculty, University of Texas Medical School. Lyme disease is a bacterial infection caused by a spirochete known as Borrelia burgdorferi. The manifestations of an infection depends on which part of the body is invaded. Symptoms may be mental or physical. If the organism invades the musculoskeletal system, the patient may develop arthritis, transverse myelitis, a picture constable with a lumbar disc herniation. If the organism invades the cardiovascular system, the patient may develop heart block. If it invades the blood vessels, the patient may develop vasculitis with the potential of a stroke. If the Lyme organism invades the nervous system, depending on what part of the nervous system it predominantly involved, a picture of multiple sclerosis, ALS, dementia, Parkinson's may appear. If it invades the brain, various mental illnesses have been described, where medical literature has described numerous studies where Lyme disease has simulated schizophrenia, bipolar, depression, rage. The current 2-tier testing for Lyme disease is extremely inaccurate, the ELISA and the Western blot. Again, according to Dr. Miller, the medical literature states that the ELISA test may produce 50% false negatives. In other words, patients may actually have Lyme disease and the screening ELISA test be negative, and the patient will be told that they do not have Lyme disease. This disease will be excluded. Going back to the literature, Dr. Miller notes that the Western blot excludes bands 31 and 34. Keep in mind, there are many different spirochetes that cause infections. On the outside of the spirochete are protein bands. The protein bands that are very specific for the Lyme organism are bands 34 and 31. These proteins are so specific to the Lyme organism that they were included in the Lyme vaccine that was available in the United States from 1998 to 2000. And yet in this country, most laboratories exclude bands 31 and 34, rendering the Western blot invalid. Symptoms of Lyme disease. Not every person will present with every symptom. Borrelia burgdorferi. The predominant bacteria that causes Lyme disease in the United States. Symptoms can include, but are not limited to, stiff neck, Lyme carditis, eye floaters, bullseye rash, Bell's palsy, migrating arthritis, joint swelling, chills, fatigue, fever, headache, anxiety, brain fog, cognitive difficulties, depression, sleeping problems, heart symptoms, autoimmunity, bladder irritation, gastrointestinal dysfunction, joint pain, muscle aches and pains, burning and tingling in the hands and feet. Additional symptoms: dizziness, ringing in the ears, sound sensitivity, tremors, visual changes. Lyme often presents as ADHD in children, and many Lyme doctors are finding a very strong tick-borne and autism connection. The term Lyme disease is actually quite confusing because there are several co-infections that go along with Lyme disease that can be just as dangerous. Another misconception about tick-borne infections is that they are only spread by ticks. Any biting insect can transmit these infections. This includes, but is not limited to, mosquitoes, fleas, and horseflies. Lyme disease is also being passed from mother to child. With proper testing, it is documented that my mother has the infections as well as myself and my 3 children. In 2019, the Lauren Russell Lyme Disease Prevention and Protection Law was passed in the state of Illinois. This allows doctors to test and treat chronic Lyme disease without fear of losing their licenses. However, you must find a doctor who follows ILAD's guidelines for proper testing and treatment. And unfortunately, most Western are uneducated on chronic Lyme disease and tick-borne infections. I'm Dr. Serafino Soro, an internationally trained family physician. I was asked by a patient to write this article to help create awareness for many in need of help. Helping patients optimize their daily life to increase one's quality of life is fundamentally my goal. I'm going to stop there. The story goes on just a little bit further, but I managed to do it without completely messing up the story. And it's an incredible one. The only thing that I will add, because it's new news to us Lymies this week, and I've already talked to Jessica about it, we're excited. The CDC finally is recognizing that chronic Lyme disease is a thing. So hopefully that will change insurance coverage soon and more doctors being educated about the disease. But keeping the awareness going is so important. Just like in Jessica's mom's story, Tonya, that's how she got diagnosed, was through another Lyme patient, through word of mouth. So please share these stories. I mean, can you imagine thinking that you have ALS only to find out that it's actually Lyme disease and it's treatable? So I hope you guys are having a good evening. Thank you for taking the time to listen, and thank you for taking the time to share the story. Good night.